Hi, I'm Dr. Bhargav Raut from Pathofast Lab in Pune. Very often we get female patients who come to us for the prolactin blood test. They are not pregnant, but the prolactin value is higher than normal. And they're usually wondering what could be the cause of this. And today I'm going to tell you everything about this. So the prolactin is basically a hormone which is only required in women who have already given birth and who are breastfeeding. It's necessary for the manufacturing or the making of the milk in the breasts, and that's the only real use of the prolactin. Some other uses include maintaining proper libido and mood. Now the prolactin is in women, it's normally the normal range should be something less than 23 in non-pregnant women, and the hormone is something which can vary in the time at different times of the day, so it's important to test this usually in the morning. The most common cause of a higher than normal prolactin in a non-pregnant woman is usually a growth in the brain which is called a prolactinoma. Prolactin is normally released from a small little gland in your brain called the pituitary gland, and sometimes there is a swelling or growth in this gland which begins to release more than normal amounts of prolactin. This is the most common cause. The next most common cause include medicines like antipsychotics or antidepressants which are known to affect and increase the levels of prolactin. Lastly, any problem with your thyroid, if your thyroid is not working properly, can also cause an elevation of your prolactin. There are many other causes which also could include infections, but I've only listed these three because they are probably the most common and important ones for you to know. So what are some of the symptoms that you're going to experience if your prolactin is higher than normal? The most common symptom is menstrual irregularities. You may completely miss your periods. Your periods may become irregular. The timing between the two cycles may change from cycle to cycle. You may experience heavy bleeding, sudden bleeding when you're not expecting it. You may also have things like breast tenderness, breast pain, or a discharge from your breasts. All these things are possible if your prolactin levels are higher than normal. How much of an elevation is considered to be dangerous? So as a rule of thumb, if the value is less than 50, doctors would usually just ask you to retest it. There are some things that can cause a incidental high level of prolactin, and one of the most surprising causes is the pain that you feel when your sample is drawn, when the needle goes into the vein of your arm. That pain itself can cause your body to secrete a little bit of prolactin, which can then show up in the results. Whereas you might not actually be having, you might not actually be having a higher than normal prolactin level. Other than this, but if the value is higher than 100, or if it's even between 50 to 100, or it is less than 50 and it has come up as high on two separate occasions, your doctors will have to investigate further. They'll have to check which medicines you're on. They may ask you to do an MRI, which is a scan of your brain, to check whether this growth is present in your brain, which I spoke about earlier. And they would also check your thyroid to make sure that it's normal. So there is sufficient amounts of treatment modalities are available for an elevated prolactin. You don't need to panic. First of all, the value needs to be significantly high to start treatment. Treatment options include medicines, which are just tablets that you have to take, which will reduce the size of this growth and also improve your symptoms. Other than this, stopping the medications that may be actually causing the prolactin to go high, like the antipsychotics or the antidepressants, will also help. Treating any problem with your thyroid is also very important because that can cause a derangement of your prolactin level. And we also have options where doctors can go into your brain and perform a surgery to actually cut out part of this growth, but that's a last resort and is only done when everything else has failed. So there are a lot of options available. Most people respond pretty well to just oral medications, so you don't need to worry about it.